The diagram before you, this diagram we are looking at, is just trying to explain what polycystic ovarian syndrome is, because I am talking about polycystic ovarian syndrome today. Yes, polycystic ovarian syndrome is the most common cause of infertility right now for women, and it happens as early as 20 years. Most ladies in their 20s, they're already having this polycystic ovarian syndrome. Polycystic ovarian syndrome is hormonal imbalance condition that occurs when your ovaries as a woman will begin to produce a particular hormone called androgen in excessive level. This androgen is usually excess for men, but you as a woman, your ovaries now that will begin to produce this particular hormone androgen in excess level. And when this happens, you will develop what we call polycystic ovarian syndrome. What are the symptoms you will see in yourself that will make you understand that you are having polycystic ovarian syndrome? Number one is irregular menses. When you are menses is not regular, you will see it this month, you won't see it next month. Sometimes you don't even see it at all. And when you are seeing it, you are bleeding excessively. This is one of the signs that you are having polycystic ovarian syndrome. Number two is abnormal hair growth. As a woman, you just notice you're growing hair on your face, sometimes on your chest, on their navel, everywhere. They just notice some hairs are growing. It's an indication that you are having polycystic ovarian syndrome. Number three is thinning of hair. Your hair, you begin to lose your hair, some hair patches, so you begin to grow what we call bad hair. All of a sudden, you're losing your hair either in the front or at the center. It's an indication that you are having polycystic ovarian syndrome. Number four is acne. Polycystic ovarian syndrome usually cause acne on your face or at the back, even on your chest, okay? This is another indication. Number five is obesity. When you have polycystic ovarian syndrome, you find it difficult to maintain a healthy weight. Okay, when you're adding an excessive weight that you don't understand, it's an indication that you are having polycystic ovarian syndrome. Number six is skin tags. An extra skin like on your neck or in your armpits, just a little flap of skin on your neck or on your armpit, is an indication that you are having polycystic ovarian syndrome. Number seven is darkening of skin areas under your breast, on your neck, on your armpits. You just notice some darkening area on these areas I just mentioned. It's an indication that you are having polycystic ovarian syndrome. The number eight is cyst. When you go for a scan, they will tell you that your ovary is larger than normal. That is a cyst in your ovary, which we call ovarian cyst. That will be a discussion for another day. Okay, it's an indication that you are having ovarian syndrome. And the last one is infertility. You cannot conceive. You are finding it difficult trying to conceive, finding it very difficult to conceive as a woman. It's an indication that you have polycystic ovarian syndrome. Polycystic ovarian syndrome cause is unknown, but it is actually linked to genetics or obesity, and when your body is producing excessive insulin hormone. So if you notice any of these symptoms, quickly go to the hospital to see a gynecologist so that they can place you on the treatment as soon as possible. All right. Thank you. Bye.